Welcome to a vital discussion about dementia awareness, a topic that touches millions of lives. Every 65 seconds, someone in the United States is diagnosed with Alzheimer's disease, the most common form of dementia, according to the Alzheimer's Association. Globally, over 55 million people live with dementia, yet its early signs are often mistaken for normal aging, delaying critical care. Dementia isn't a single condition, but a collection of disorders affecting memory, thinking, and social abilities, impacting lives gradually, not destroying them outright at first. Recognizing these early signs can be a blessing, offering a window for timely intervention, support, and hope. Today, we'll explore the 10 key early signs of dementia, helping you distinguish them from typical age-related changes. Backed by verified research, this guide will show when these signs appear, how they progress, and why early action matters. This isn't about fear, it's about empowerment, equipping you to advocate for yourself or loved ones. Early detection can lead to treatments that slow progression, lifestyle changes that enhance well-being, and plans that preserve independence. As we dive in, reflect on those around you. Have you noticed any of these changes? This information is for educational purposes only and not a substitute for medical advice. Consult a doctor if you see persistent changes. Let's begin this journey to clarity and care with the first sign. 1. Memory problems. Memory issues are often the first clue that dementia may be developing, but not all memory lapses are the same. Normal aging might mean occasionally misplacing keys or forgetting a name momentarily. Dementia-related memory loss, however, is persistent, severe, and disrupts daily life. A 2020 neurology study found that 60% of early Alzheimer's patients struggled with short-term memory, forgetting recent conversations, meals, or appointments despite reminders. They may ask the same question repeatedly within minutes, unable to retain answers. Long-term memories often remain intact, creating confusion as loved ones notice a contrast between vivid past recollections and recent forgetfulness. This can be emotionally distressing, leading to embarrassment or avoidance of social situations. Some may compensate with notes or repetition, but these strategies falter as symptoms worsen. Family members often spot this during everyday interactions, a parent repeating questions or forgetting birthdays. If memory problems consistently impair work, relationships, or independence, seek a doctor's evaluation. Tests, medical history reviews, or brain scans can clarify whether it's dementia or a treatable issue like medication side effects. Early action can open doors to support, making a profound difference. 2. Difficulty with familiar tasks. Imagine struggling to cook a recipe you've mastered for years or getting lost while driving a familiar route. Difficulty with routine tasks is a hallmark of early dementia, reflecting a breakdown in procedural memory and executive function. A 2018 Journal of Alzheimer's Disease study noted that 25% of early-stage patients struggled with tasks like managing finances or using appliances. These aren't new, complex activities but everyday routines that suddenly feel overwhelming. The decline starts subtly, taking longer to balance a checkbook, skipping steps in a recipe, or forgetting how to use a smartphone app. Tasks like paying bills or minor repairs become confusing, not due to physical limitations but cognitive changes. This can lead to frustration, anxiety, or withdrawal, with noticeable mood shifts. Unlike occasional mistakes, frequent difficulties that affect independence signal a need for medical evaluation. Early diagnosis can uncover dementia or treatable causes like vision issues, ensuring the right support to maintain daily life. 3. Language problems. Struggling to find the right words or follow conversations is another early sign. Unlike occasional tip-of-the-tongue moments, dementia-related language issues are persistent and disrupt communication. A 2020 Journal of Neurology study found that 20% of early Alzheimer's patients experienced anomia, describing objects, for example, calling a pen the thing you write with or pausing mid-sentence to search for words. Following complex discussions or group conversations becomes challenging, and reading comprehension may decline, rereading paragraphs without understanding them. Writing becomes messy, with spelling errors or disorganized thoughts. Repetitive speech, like retelling the same story, is common, often unnoticed by the person. These struggles lead to frustration and social withdrawal as individuals sense their difficulties. Loved ones can help by speaking slowly, using simple sentences, and allowing time to respond. Speech therapists can offer strategies, but if language issues disrupt daily life, a doctor's evaluation is essential to check for dementia or other causes, paving the way for support. 4. Disorientation to time and place. Feeling lost in time or space is a deeply unsettling sign of dementia, going beyond forgetting the day of the week. A 2019 Dementia and Geriatric Cognitive Disorders study reported that 40% of early dementia patients showed confusion about dates, seasons, or locations. Someone might think it's morning when it's evening, or believe it's winter in summer. They may lose track of time, spending hours on short tasks, or struggle with concepts like later today. Spatial disorientation can mean getting lost in familiar places, like their own home, or forgetting room locations. This poses safety risks, leaving appliances on, missing appointments, or wandering. It may cause anxiety, depression, or inappropriate behaviors, like dressing for the wrong season. Loved ones often notice these changes first. Technology like reminders can help early on, but worsening symptoms may require supervision. A professional evaluation can assess the condition, recommend safety measures, and support independence, offering peace of mind for families. 5. Poor judgment. Uncharacteristic poor decisions signal cognitive decline, not just occasional errors. A 2019 neuropsychology study found that 25% of early dementia patients showed impaired judgment, like falling for scams, making reckless purchases, or neglecting hygiene. Financial missteps, giving away money or distrusting banks, are common. Safety can be compromised, with unlocked doors or unsafe driving. Social judgment may falter, leading to inappropriate comments or oversharing. These changes, rooted in cognitive decline, strain relationships and health decisions. Families face challenges addressing them without seeming controlling. Empathy and early medical evaluation can distinguish dementia from other causes, like depression. Legal and financial planning, such as powers of attorney, should start early to protect autonomy. This proactive step can be a blessing, ensuring safety and dignity. 6. Misplacing things. Frequently misplacing items in illogical places, like keys in the freezer or milk in the pantry, is a frustrating sign. A 2017 Alzheimer's and AMP dementia study noted that 35% of early dementia patients exhibited this behavior. Unlike occasional forgetfulness, individuals can't retrace steps, leading to accusations of theft that stress relationships. As dementia progresses, items end up in increasingly odd spots, raising safety concerns if medications or dangerous objects are lost. The emotional toll includes anxiety and embarrassment, worsening other symptoms. Organizing the home, labeling items, or using key finders can help early on, but these strategies may fail later. Occupational therapists can suggest practical solutions. Responding with empathy, not frustration, preserves dignity. If misplacing disrupts life, a medical evaluation is crucial to address underlying causes and ensure safety. 7. Mood and behavior changes. Mood and behavior shifts are among the most challenging signs, often appearing before memory issues. A 2018 Journal of Alzheimer's Disease study found that 20% of early-stage patients showed changes like depression, anxiety, or irritability due to brain changes, not just aging. A patient person may become agitated, or an outgoing one withdrawn. Paranoia, unfounded suspicions, or sleep disturbances like insomnia can emerge, straining relationships. These shifts lead to isolation, worsening cognitive decline. Distinguishing them from medication side effects or other conditions is key. Treatments like medications, structured routines, or counseling can help, alongside family support. Recognizing these as symptoms, not flaws, fosters compassion and connection, guiding families toward professional care. 8. Withdrawal from social activities. Avoiding social events, hobbies, or work is a significant warning sign, often mistaken for normal aging. A 2020 American Journal of Geriatric Psychiatry study noted that 30% of early dementia patients withdrew due to memory or communication struggles, anxiety, or depression. This isn't a preference for quiet time but a persistent avoidance of once loved activities, driven by fear of embarrassment. Isolation accelerates cognitive and physical decline, straining family ties. Encouraging participation, offering company, or seeking professional help can maintain connections. Early intervention addresses underlying issues, preserving mental sharpness and emotional well-being, a vital step for quality of life. 9. Changes in sleep patterns. Sleep disturbances, like insomnia or day-night reversal, are often overlooked but significant. A 2020 sleep medicine study found that 25% of early dementia patients experienced persistent sleep issues, such as trouble falling asleep or frequent waking, due to brain changes, anxiety, or medications. These disrupt routines, increase fall risk, and worsen mood and cognition. Poor sleep leads to daytime fatigue, reduced focus, and accidents, affecting caregivers too. Good sleep hygiene, consistent schedules, calm environments, or medications can help. Professional guidance supports safety and rest for all. Addressing sleep issues early enhances overall health and resilience. 10. Trouble with visual and spatial relationships. Difficulty with visual and spatial tasks, like judging distances or reading, reflects brain processing changes, not just vision issues. A 2021 brain study noted that 15% of early dementia patients struggled with depth perception, making stairs or driving challenging. Reading becomes hard, with skipped lines or confusion, and distinguishing colors or contrasts declines. Some may not recognize themselves in mirrors, causing fear. These issues increase fall risks and limit independence, causing anxiety. Adapting environments, better lighting, clear paths, helps, but professional evaluation is essential to distinguish brain-related issues from eye problems. Early action supports safety and mobility. These 10 early signs of dementia: memory problems, difficulty with tasks, language issues, disorientation, poor judgment, misplacing things, mood changes, social withdrawal, sleep disturbances, and visual spatial problems, are your guide to proactive care. Recognizing them empowers you to seek early diagnosis, opening doors to treatments, lifestyle changes, and support that enhance quality of life. This knowledge is a blessing, offering hope and clarity for you or your loved ones. If you notice persistent changes, consult a doctor for a thorough evaluation. May this awareness lead to a healthier, more connected future. If this content has inspired you, please like, share, and subscribe for more insights to support your wellness.